Following segment is sponsored by Advanced Body Scan of Tulsa. Proactive preventative care for your health can bring an early look at any possible issues. It can also give you peace of mind. And that's why you might want to visit Advanced Body Scan of Tulsa. Lindsay Hansen is there this morning with Dr. Robert Mitchell. Good morning, Lindsay.
Good morning, everybody, and good morning to you. Thank you for joining us.
Thank you for being here.
We are talking about Men's Health Month. June is Men's Health Month, and men do have some concerns that are some of those top concerns that most people are challenged with, you know, heart disease, cancers.
Yes.
How do these scans help us detect those things early?
Absolutely. So with this scan, we're really looking at the heart evaluation in terms of potential blockage in the coronary arteries, which is the leading cause of death in men in the United States. And we're able to see to, what extent is there blockages in those arteries, if it's minimal, moderate, or severe blockage. And then, the next best step is then proceed to the cardiologist for some intervention.
Absolutely. So we want to encourage people before they have symptoms. This is what preventative care is really about. But obviously, there could be some symptoms associated with that as well.
Sure.
What should people be looking for?
Absolutely. As you mentioned, this is about prevention. And so in this country, we do a great job in intervention. But the emphasis really in medicine in the United States is prevention. So for men, using this month in particular, they should know about blood pressure and the management of that. So in addition to that is blood cholesterol, blood sugars, which would be diabetes, healthy weight, exercise, and if for a patient that is a smoker, visiting with their physician about assistance and help stopping smoking.
Absolutely.
All of those things are leading, contributors to coronary artery blockage. And so again, this being, prevention, that's an important first step. The second, obviously, is we have several male patients. Men come in and say, look, I'm pretty healthy. I don't take any medications, but my father, my grandfather, my uncle, maybe my brother has had sudden heart attack or death. I just want to know, kind of where do I fit into that? And so this is an ideal study. It's non-invasive, takes about 5 minutes, and we can tell them that, yes, you have no evidence of coronary blockage, or this is probably something that you want to visit with your physician about.
How often do you recommend someone come to do a preventative scan?
Yeah, absolutely. So let's say a patient without symptoms, without a significant family history once a year, I think is a very reasonable time to redo that heart and lung scan.
So in addition to the heart and lung scan, there's other scans that you guys offer, full body, lots of other things that people can come and do for their preventative health.
You bet. For patients specifically, say, well, I'm super interested in heart and lungs, but also, have a family history or have some pain in and around the liver, the spleen, the pancreas, the colon. So in that full body scan, we're assessing all of those organ systems from the upper abdomen to the pelvis. And so that gives us about a 17 organ system, insight as to whether or not there's disease there.
Yeah.
Colon specifically, we offer a virtual colonoscopy, which standard traditional colonoscopy is with a rigid scope, not fun to have, but is associated with some risk. That is not the case here. Okay. It's basically fundamentally the same as the heart and lung scan to take a look specifically at the colon.
Okay. Well, we appreciate it. Thank you for sharing that. This is such important information because we really want people to take control of their preventative health. And of course, I want to reiterate that the $79 heart and lung scan, that special runs through the end of June. So now is the time that is worth over $1,300. You don't want to miss out on that opportunity. All right, back to you.
Thank you very much, Lindsay. Let's get you the details here. It's Advanced Body Scan of Tulsa. They're at 5711 East 71st Street. They're in suite number 100 there. Their phone number, 918-879-6161. You can also go to www.advancedbodyscanoftulsa.com. They also do have a Facebook, Twitter, and Instagram page.